Welcome to our webinar this morning, this afternoon, where you are. We're so glad to have you joining us from all over. I see a few people here in the chat already inserting in where you're from. Why don't you take a moment? Tell us where you're joining from today. It's always fun to see the nationwide and the global reach of the healthcare industry, the pharmaceutical industry, and the attendees of our webinars. Now, we'll just go ahead and give everyone about a minute or two to join in, and then we'll officially get started today. I see the West Coast. I see California. I also see the East Coast. I see some fellow Georgians here in the chat. I also see some in Florida asking for rain. Welcome in, welcome in. I will go ahead and answer the question of will this session be recorded? This commonly comes in at the start of the webinar. The answer is yes. All of our recordings of our webinars are available on our website, and you can find all of the insights that we covered today, as well as the presentation, the slide deck itself, on our website as well. All right, so welcome everyone to today's webinar. Why are prior auths fatal? My name is Kiana Dixon, and I am the moderator for today's session. ACMA, the Accreditation Council for Medical Affairs, is hosting this webinar to provide you with valuable insights and expertise on this critical topic of prior authorization. As providers of the official prior authorization certification path, we understand the significant impact that prior authorizations can have on patient care and as well on provider workflows. Today, you'll hear from my two specialists, experts in this field, prior auth specialists. We have Dina Mastriani, the prior authorization supervisor at Schweiger Dermatology Group. And Dina has over 20 years of experience, as a registered medical assistant with a focus on dermatology and the authorization of biologic treatment. She is also certified as a prior authorization certified specialist. We are also joined today by our second speaker, Heather Thomas, the prior authorization certified specialist at the Cardiovascular Institute of Michigan, PC. Heather has been PACT certified since 2021, and she specializes in cardiology, electrophysiology, and urology. Her passion for patient care has led her to pursue a career in prior authorization. Now, today during this webinar, you're really in for a treat, as Dina and Heather will share their unique perspectives and their experiences in navigating the complex world of prior authorization. They'll address the impact on patient care, the common challenges that they face in their role, and strategies for overcoming those obstacles that you may can use. We'll also leave time at the end for a question and answer session at the end. So please feel free to submit your questions that you have for the speakers or myself throughout the presentation today. During the next hour, we'll be covering a range of topics related to prior authorization. Again, from the patient impact to the challenges faced by specialists, and as well as strategies for success and a look at the future outlook of these processes. So let's dive right in, and we'll start with an overview of what prior authorizations are and why they are such an important issue in healthcare today. Now, just by way of quick recap, a prior authorization is designed to make sure certain prescription drugs or devices are used correctly and only when medically necessary. As we will explore more in depth today, prior authorizations have a significant impact on patient access to care, as well as the administrative burden placed on providers and their teams. Understanding the fundamentals of this process is really critical to addressing the challenges that we face. Again, we have two specialists in the prior authorization space in discussion of this process. So Dina and Heather, can you tell us more about your current responsibilities in your role and where it fits in terms of the prior authorization process?
So for biologics, I submit them directly through Cover My Meds or forms or whatever is required by the insurance. Or I work directly with specialty pharmacies who submit the prior authorizations for us, and I manage and monitor the process to make sure the patients are getting their medication in a timely manner. And then I also created some training material for the clinical staff at Schweiger Dermatology for them to just have reference to criteria needed in the office note, that are required by the insurance company for these medications.
As far as what I do prior authorizations for my practice. Right now, we specialize in cardiology and electrophysiology. I have worked in previous cardiology practices where I was also responsible for getting the prior authorizations for surgical procedures, as far as implants, TAVRs, cardiomems, anything like that. My responsibility is to get authorizations for any sort of testing, whether it be in our office or in a hospital setting, to make sure anywhere from echocardiograms through nuclear stress testing or along the sorts of that, just for all of our patients to make sure that they get their testing done, because that's where everything begins, is to make sure that they get the authorization for the test, because it starts off, just a simple test can start off something really, really big for a patient in cardiology.
Yes. I love both of your answers because we are really, again, having insights from experts at the provider's level. They're at the crux between the providers as well as the patients, and they're dealing with prior authorizations from the very start of therapy, right? With diagnostics and with testing, all the way through treatment therapy and medication therapy as well. Now, prior authorizations, they have far reaching consequences across the healthcare system. And I've done a bit of research here, and according to the AMA, the American Medical Association, and their survey of physicians that they release each year, last year we saw that prior auth issues contribute to about 94% of care delays. So if a care delay occurs and prolongs a patient's access to the originally prescribed product or test, then there is now a delay in better health outcomes, right? There's now a delay in improvements in care. And this is very concerning for us who are in the healthcare system, because our end goal, right, is always the patient. The data here highlights the significant impact of prior authorizations on patient access, as well as adherence. When when prior auth requirements are imposed, less than a third of patients end up receiving that originally prescribed treatment. And about 40% end up completely abandoning their therapy together, right? They just say, forget it. This is taking too long. I'll just not even take a medication or a therapy. And this is a concerning trend that directly undermines the healthcare system's goals of ensuring timely and appropriate care for patients, right? Again, that's our end goal. Here on this slide, we see a pie chart discussing the impact of prior authorizations on those clinical outcomes, whether they have a positive impact or a negative impact. And based on this data given and provided by the American Medical Association, we see more often than not, prior authorizations have left a negative impact on their patients. Now I'm interested to hear from Dina and Heather their firsthand experiences on the patient impact that they have seen as a result of prior authorizations. Now, Heather, how have you witnessed these types of scenarios play out in your day-to-day work? How can you share a specific example of how a prior authorization delay might negatively impact the patient's care?
Unfortunately, in my specialty, we see it all the time. We're cardiology. Your heart is the basic thing of everything that you do. And any little simple symptom can be a large impact of really something in the background going on. And from the very simple tests, from the very beginning, if you don't get that authorization hand, it can go really, really far and into diagnosing actually what's going on for a patient. I know, for example, one time we did have a patient, they were having symptoms and the doctor wanted to order a test. However, the insurance company, when I submitted the authorization request, it didn't meet the immediate criteria for it to be approved. So it went into a pending status, which had them, because they didn't qualify as being what they call emergent, which is by definition life and limb threatening, it could have taken up to 14 days for them to determine if the patient met medical criteria in order to have the test. What ended up happening is, because of the fact that the authorization went into pending status, the physician actually sent the patient to the emergency room, because they have different criteria as far as authorizations for tests in an emergency room versus an outpatient setting. What had happened, what we found out later, was the patient did end up having a blockage, which did need coronary intervention. If we would have waited the 14 days, he could have been critical. So if we see it all the time, it's very unfortunate. But if we don't follow the rules of what we have, it could potentially ruin a person's life.
Yes, now that's a powerful example, because it really highlights the very real consequence, right, that prior authorizations can have on outcomes, on patient care. And to me, it's clear that this is an issue that requires urgent attention and very careful attention to detail as well. Now, Dina, on the flip side, I know you've experienced some situations where you help ensure patients receive the most appropriate treatment. Can you tell us more about that?
Yes, I received a denial for a biologic for a patient because they didn't try and fail multiple medications ahead of time. So I was able to, the patient did end up trying, the medications that were needed. So I was able to find the documentation and go on to Cover My Meds and hit the renew button, which allows you to send the information that they need, and they turned around the denial to an approval rather than having to go through an appeal process or an patient assistance program. I was just able to renew it, got approved, and the patient ended up receiving their medication, that was prescribed.
Now, with that process, if they did go that other route and you weren't there to essentially help guide them into this quicker route, how long do you think that would have taken, or what the impact on the patient would have been in order to enroll into a patient assistance program?
As far as the enrollment, it would have probably taken a week, 10 days if they weren't already enrolled. And do we have the letter, the denial letter to send there? Do we have to get that? Do we have to call for it? A whole bunch of things that can cause issues.
So on top of the initial paperwork that's required, it would have added even additional burden, right, on the patient themselves that they have to provide, as well as on you, right, to help the patient enroll into one of those programs. And again, we're hearing the 1 week, the 10 days, the 14 days, how this may sound like a very short time in hindsight, but really every day matters here, especially with prior authorizations, and we're working with patients one-on-one every day. So with these powerful examples that we have discussed here with Heather and Dina, we've already highlighted some of those common challenges, right? We've discussed time, paperwork as well, but there are some other common challenges that occur during these processes that we should highlight as well. Now, at the heart of prior authorizations in this issue is the fundamental goal of the healthcare system, again, to ensure timely and appropriate access to care for patients. However, as we've discussed, the current landscape surrounding prior authorizations can create significant barriers to that access. Areas that a patient access professional or prior authorization specialist must be adept to include is a thorough understanding of these goals of the healthcare system, right? A comprehensive understanding of the ins and outs of the healthcare system, including how it's funded, how patient access is determined by different payers, understanding what some of those roadblocks are to a patient accessing needing a medication or service or an equipment, a medical device. Right? These are just as important as knowing information about a medication or a manufacturer's product, as well as how it benefits patients. Now, this slide illustrates the key stakeholders involved in a prior authorization. We have the payer, the provider, the pharmacy, and again, ultimately the patient. And each of these entities play a critical role, but the misalignment of incentives and the lack of transparency can lead to breakdowns in this process among all of these arrows, among all of the stakeholders that you see on the screen, right? There are a lot of hands in the pot. And oftentimes that comes with that misalignment because we aren't visible to each other's process. Right? Furthering more on the challenges that we've discussed earlier, Dina and Heather, what are some of those most common challenges that you face when processing prior authorizations?
So delays are the biggest issue. They happen for multiple reasons. It could start with, the office doesn't have the prescription card in the chart, or the office note is missing information, or the patient isn't answering the phone to obtain this information, or for the specialty pharmacy. Specialty pharmacies may just be behind with submitting prior authorizations, as well as even filling the prescription. And then insurance companies, I say behind because that's the word they use, is, they're behind a couple days with even processing a determination. So all these delays cause delays in treatment.
Mm-hmm.
Absolutely. I totally agree on that. Part of my challenges is obtaining prior authorizations is I first have to know all my payers and all my insurance companies, how long it takes to actually get a prior authorization. Some I can go into the portal and get an instant authorization on a test, and that would be fine. Others, I know, even if it does meet medical necessity, it can take days, weeks, and everything before they would even review it and make some sort of determination. So I have to keep on consistently looking at my testing schedule, looking at my patient schedules to know what testing is coming up, which ones I need to immediately work on, reviewing all the clinicals, making sure that I have everything. If I don't, making sure that I'm going back over to the physician to make sure that the clinicals are complete and set before I submit the prior authorization, so that nothing delays the test from being completed.
Gotcha. Now I'm hearing delays. So it sounds like you both are essentially overstepping in case that there is a delay that may occur from the payer side. So how you over prepare for a prior authorization that may come through, I think is what's very important and really helps us transition here into the conversation of solutions and opportunities that may occur and how to potentially avoid those delays. Right? These issues of delays can create significant friction in the healthcare system among all of those stakeholders that we just mentioned. Can you share some strategies that you've employed yourself to overcome some of those challenges?
For me, I'm sorry, Dina. Go right ahead.
Yeah, Heather, you could go ahead with a few of your effective strategies that you see.
Okay, absolutely. For me, the only thing I know in my head is organization all the time. I consistently have to work forward. I'm generally about 2 to 4 weeks ahead on my testing schedule to know what is scheduled. It's because, again, if I'm working with this payer, I know I can get an immediate authorization. If I'm working with this payer, I know it's going to take me about 2 to 3 weeks to even before I get an answer on that. So if I am not ahead of my game and making sure that I'm looking forward and working on things forward versus current, I wouldn't get anything done. So I'm constantly having to future see what is going on to make sure that when that patient walks into the door, I have their approval.
Yes. So proactive planning, proactively addressing the challenges that may occur. Dina, what have you seen kind of actually works for prior auth?
So same organization. I use Smartsheet for spreadsheets to monitor just my biologics. You could set the columns however you would like, and you could see where the delays are coming from. Are they coming from me, something from the office, from the pharmacy? You're able to see, put dates in. So it's a great way to just have everything in one place. I also messaging apps to communicate with pharmacies. who are assisting with your prior authorizations. It's efficient, and everything again is just in one place, and you can attach, office notes or anything that they require if they don't have access to you, to your records, and it's very helpful. And then also, I mentioned I did create the training material. I think that is very important for clinical staff to have. It's criterias are different per plan. It's a lot of information that has to be in every office note, and it's a lot to remember, and it's so many medications. So I think having something for clinical staff to reference, just to know, like you do need BSAs or whatever else is needed in an office note.
Nice. So you mentioned, so we have here on the screen utilization of available resources and tools. I'm a big believer in, if there is a resource out there, to use it, right? To enhance your processes yourself. And you mentioned Smartsheet. Is this something that you have employed for your entire practice for your providers as well? Or is this something only just for you for prior auth?
It's used within Schwager, like for multiple reasons, but yes, I use it specifically for my offices.
Gotcha. So utilizing those available resources to streamline the process and make it easier. It sounds like, to me, it's very clear that a multifaceted approach is necessary for communication, for organization, that proactive planning, and combining strong internal processes. Like Dina mentioned, that she works with her practice, that she enhances for her own practice or office in completing prior authorizations, so that we can have that effective collaboration. Now, switching gears here, given the rapidly evolving healthcare landscape, it's critical that prior auth specialists remain vigilant and well-informed about the latest policy changes that can really impact their work. As we can see from this data here, we're setting up that prior authorization programs are a rapidly growing part of the healthcare landscape. Prior authorizations as a form of utilization management isn't going anywhere, right? This is the primary way that payers aim to control and manage healthcare spending. And so the data that you see here shows that the largest categories of medical spend that are subject to prior authorizations include specialty drugs, surgical procedures, as well as retail drugs as well, accounting for a combined $884 billion in annual spend. We've also seen regulatory actions take place, like CMS establishing prior authorization for specific prosthetics. We have the Inflation Reduction Act as well. Two of the largest payers, United Healthcare and Anthem, they are also implementing prior authorizations and imposing those requirements for additional treatments such as lab tests now. So, given the expanding nature of prior authorization programs, it's again critical that specialists like Dina and Heather stay up to date on the latest policy changes, because this can impact their day-to-day work. This can impact their patient care. And policy changes are a constant concern that I hear from prior auth specialists that we speak to. With the Inflation Reduction Act, for example, we're experiencing a complete benefit redesign for Medicare. So Dina and Heather, can you share some of the strategies that you use to ensure that you are informed about these evolving requirements and guidelines? How do you proactively manage these frequent policy changes?
What I do is I consistently have to stay up to date on policy changes. A good way of doing that, honestly, is to sign up for notifications on the portals. Most of the portals that I use, I probably on an average probably use about 80 portals for different insurance companies. Big ones are obviously, Ability. They multi-manage a lot of the Blue Crosses, Aetnas, United Healthcare's, Humana, Priority Health, and everything like that. And they are a good portal to send me policy changes on every single one, as well as I can go to the direct company as well and be able to see those policy changes. CMS.gov is obviously one of the best sources, because most of your policies reflect what is happening currently with Medicare and Medicaid. So if it's a policy rule for Medicare and Medicaid, it's generally the same ones with different insurance companies. But I just can't assume that if I didn't need to get an authorization on a test last month, that this month I won't need a prior authorization on that. So being notified, I get the notifications from every single portal that I have of a policy change, and looking at that and making sure that there hasn't been nothing changed in the last month, really keeps me up to date on how I need to do my job and gain my testing approved.
So for me, I communicate field reimbursement managers from pharmaceutical companies. They keep me up to date on everything. I speak to them almost daily. They're very valuable when it comes to biologics and, any assistance that's needed with pharmacies or insurance companies. They're definitely there, and they keep me updated with, any insurance changes as well. Organizations. So for dermatology, the biologic coordinators of Derm, BCOD, they have a great website. They send magazines. There's a conference every year. If you're in Derm and doing anything with biologics and prior authorizations, they are definitely, they're so helpful for me. So definitely, an organization like that. Derm Squad's another organization. On their website, they have some great information and reference guides. So, that kind of stuff could keep you updated with everything. Prescriptions always have a benefits investigation, or if I receive something from Cover My Meds for something that's already authorized, it's more like a trigger for me to look into that plan a little bit more, because something must have changed, for me to receive that.
So I've heard from both of you major stakeholders really in this process that we discussed on those previous slides, right? Heather mentioned, she answered that question of who is important in this particular area of policy changes. And we immediately think of CMS. She highlighted CMS as a resource, but also those portals, right? This answers this question of what is out there that I can use and utilize to, again, plan proactively. Having those notifications turned on or for alerts, I can imagine is a huge game changer for those in this space. Further answering that question of who else can I reach out to, Dina mentioned some important stakeholders as well, including an FRM. Those field reimbursement managers for a particular product or at a particular manufacturing organization is very important. Use them as your resource. That's their role, right? BCOD, again, this answers that question of who, identifying where or those patient advocacy groups or other therapeutic area specific organizations that are also a place of resource for you as well. Now, as we begin to round out the content portion of the webinar, I'm very interested to hear from our specialists and our speakers today where you all see the future of prior authorizations heading. Are there any recent trends or policy changes that you think might impact the process?
I feel AI companies are going to play a big part in the prior authorization process in the future if they're not already. They're not a pharmacy, and that they're just doing the prior auths. And I think that, they're going to work more directly with specialty pharmacies in getting the authorization for them and taking the burden a little more off of the office.
Interesting.
Now, in my perspective, I don't see AI as being very beneficial to my authorization testing, because authorization testing clearly just shows medical necessity. However, when I'm the one looking to get the authorization, it's my responsibility to go through the clinicals to make sure that before I even submit it, that they meet medical criteria to have that test. A lot of times I find when I'm looking to get the authorization, they don't meet medical necessity. And it's not necessarily what is written on the paperwork. It could be possibly that the physician is looking to order a certain test and it is scheduled as a different test and they don't meet medical necessity. Now, if everything just went through and AI just picked up on everything and just submitted it without and approved it, And then once the claim is actually submitted to the insurance company with the clinicals, then they find that it doesn't meet medical necessity. The claim's rejected, and then the bill, unfortunately, is sent over to the patient for this test.
Wow. What I'm hearing you both say is essentially the thought or the idea that we're essentially may cut out time somewhere in the process, right? Dina mentioned cutting out that time of delivering that documentation required from the provider and just going straight to the specialty pharmacy and having them complete those prior auths. And Heather is mentioning using technology to narrow down the time when we're in this time of AI and technology transforming and saving people time. Now, I could spend a little extra time here discussing AI. I won't go too in depth, but ACMA, we have begun establishing our feet in the AI space surrounding prior authorizations and reimbursement. And in our research, in our data that we're finding, right, there was recently just a fine at a top insurance company who had AI implemented to review that medical necessity, the documentation that was turned in. And what they saw was that majority of those that were submitted and decided, or that decision was made by an AI technology tool, they were incorrect. And that's what we're facing with there. And I think there is this need, like Heather mentioned, for that human element. Whether you're using technology or not, there will always be this need for human expertise to still go through and fine tune and make sure that it is correct. The information, the verbiage, the terminology, it varies depending on where you are sometimes. That's why we have ICD codes, right? Having that international standard. So we need that human element as well. Now, in the future, will technology take over? Will specialty pharmacies be the only ones implementing prior authorizations? We probably can't answer that question today, but it is something that we have to consider for the road ahead, right? It's clear that prior authorizations, again, aren't going anywhere anytime soon. And in fact, the landscape is likely to become even more challenging for providers and patients. What we can do is understand where it's headed, right? These points that you see here on the screen, as well as the challenges that we're facing now and how we can overcome those. Now, we've covered a lot of ground today in the first half of today's webinar, from, again, the patient impact of prior authorizations to the strategies for success that our speakers use and utilize in their practice. So now I'd like to open the floor to any questions that you, the audience, may have for Dina and Heather. I see a few questions that have come in already throughout the webinar, so we can begin highlighting and answering those questions. Dina, what communication apps do you use to communicate with specialty pharmacies?
It's called Clara, Klara. It's an extension. We use the like an EMA system, EMR system, so it's like an extension through that. But pharmacies also use it, and we communicate our patients that way. But the pharmacies use it, so we're able to send information through that.
Is it important to have coding knowledge? I do not have it. I have to rely on others.
For me, it came as I learned. When I first started doing this, I had absolutely no idea what I was doing. I had literally a day and a half of training of what I was going to be doing, and then I was completely left on my own. I have no idea. And probably for the first couple of years, I didn't really know the coding information and how it went. But I had to do my research to find out which ICD-10 code met medical necessity for my CPT code, my test. So as I went along, I kept on learning and educating myself and everything like that. No, you don't necessarily have to have billing and coding experience in order to do that. However, the more you read, the more you know, the more you educate yourself upon it, it's going to come along, and then it's going to be like you're an expert at it. So it comes, trust me.
Dina, what about you? Do you have to have coding knowledge for biologics, you think?
I mean, just to know what biologic, what it has to be prescribed for, what it's approved for. So not so much more as like procedure codes and stuff like that, but you do need to, know a little basics for it.
Next question from Megan. Does pharmacy typically submit medical benefits as well, or do most areas separate pharmacy and medical prior auth?
So most pharmacies only submit through the pharmacy benefits. I have a few that will submit some things through medical, but not all will do that.
And I will say here as well, there are some products as well, like injectables, oncology medications, where depending on the plan or depending on the situation, it may be billed as a like a medication benefit, but it also could be billed as a medical benefit. It's just really depending on the situation itself. This is interesting. What are some ways I can learn to work in prior authorizations like you? Great question.
Start with your PAC certification.
Yes.
Right there.
Very, very important.
That's a key highlight. Like I mentioned earlier, they're both PAC certified. We provide the PAC certification. It's a 12 e-module program all online where you can complete the program at your own pace. You learn the ins and outs and become an expert in prior authorizations. It's not therapeutic area specific, it's prior authorization specific. So you really learn a lot about the process that you can use no matter which therapeutic area you're in. How helpful has it been using pharma manufacturers' service center or portal?
I think portals are very helpful. If you're able to submit benefits investigations on there, as we talked about plan changes and stuff, it's a quick way to get your hands on it, and just to follow the process of what's going on with the patient's medication if they're going through patient assistance.
Is there a list of medications that need prior auth? Can I find out from the software the pharmacy uses?
So as far as biologics, it's just to assume that they all need prior authorization. Some don't, some plans don't require it, but there's no specific list because it depends on the plan. Unfortunately, no, we don't have the software the pharmacies have. That would be fantastic. But like we just mentioned, the farm companies have portals that allow you to do the benefits investigation where you could see for yourself, just kind of like some information the pharmacy gets. You'll get the copay amount and the mandated pharmacy. So yes, the portals could help with that.
Is there a one-stop shop to access payer policies?
No. Unfortunately not. I mean, there, like I said, I probably have access to about 80 to 100 different portals, each different insurance companies. A lot of the insurance companies lately don't do their own prior authorizations. They have a third-party vendor that will actually do the prior authorizations as well. So, and each insurance company has their own different criteria about what needs prior authorization or what doesn't. Like I said before, most of them will mirror what CMS says would need prior authorization for, so if it's a Medicare Advantage plan, most of them will mirror what CMS says. If it's a Medicaid program, it'll mirror what CMS says as well. However, each insurance company does have their different requirements for what does need prior authorizations and whatever it is. And so there is not one stop place to get all that information. A lot of the insurance companies, though, are going to a bigger platform. For example, I mentioned Ability earlier. They have probably one of the biggest platforms that you can look for multiple insurance companies on there versus just, like RadMD just looking for the meridians and everything. So they probably have like maybe a list of like 50 insurances that you can look for their rules, regulations, submit the authorizations, and everything. So they are getting a little bit bigger, but it's not, unfortunately, one-stop shop.
Mm-hmm. I see some people already have put it in the chat as well. Policy Reporter, they're a really good resource. It's not free. I don't know if it's license based, or I'm not sure how their pricing model works. But this may be something that you bring to your employer to see if you can, have access to that as well. How do you get started without a lot of experience in field reimbursement management? So I can answer this question. Our speakers today, they're prior auth specialists on the side of the provider versus the side of the manufacturer. So we do have an FRM webinar actually coming up pretty soon this summer. I believe it's in June. Look out on our website, Prior Auth Training, to learn more, priorauthtraining.org. And we will announce that date for that webinar. We will have the ins and outs with FRMs who are also PAC certified, and how to get started in that role as well. I don't want to take away from this webinar about FRM. Instead of going through specialty pharmacy or approving as prescription benefit, what has been your experience with successfully approving under the medical benefit and injecting in the office through buy and bill?
So honestly, I don't have experience with buy and bill. It's not something my company does. So we don't buy and bill.
We've done, in our practice, in cardiology, we don't do any of that. But when I worked urology, we did a lot of buy and bill. However, there was some things that we couldn't do because obviously we couldn't get the medication. We didn't have the staff in order to do injecting in the office. So there would be no way that we can buy and bill and do that and just do it in office to save the time or to bill it under medical. So it's kind of the way of the practice to see if it's possible to do it in your practice in order to be able to bill one way or the other.
Yeah, I hear it's great and beneficial and like a game changer, but it's just not something we do.
Mm-hmm.
How do you go about getting a copy of a policy for a medication that you have had difficulty getting approved?
So I just look up policies if I'm looking, I just honestly go on Google and look it up that way because they change all the time. So I'm just trying to understand the question. Get policy for a medication to see if the patient meets the criteria for it, I guess.
I think
that's
so.
Right.
Sorry, go ahead, Heather.
No, I think that's what they're saying, that if you're trying to figure out what the policy is for, in order with the, prerequisites to get a prior authorization on a medication, the insurance portals will basically have their policies and guidelines there. So you should be able to go into the specific portals and look up that specific medication, and they should be able to tell you what the criterion is in order to get an approval for that.
Yeah, you could just look up the plan and it'll tell you right there what's needed for it.
I'm PAC certified. How do I find jobs? That's a good question. I can take this as ACMA moderator here. We offer plenty of resources. Patricia, if you haven't already, go ahead and join on LinkedIn. We have a PAC grad only LinkedIn networking group. Networking is the number one suggestion that I have when you're in the field or in that hunt for looking for a new role. Reach out to other PAC grads, ask them about more experiences, ask them the questions that we have on this webinar so that you can learn more and as well communicate more to those employers when you are on interview. Can you name the top prior auth third-party vendors? Is this for portals to complete a prior auth? I think that may be where they're asking here. But from what I've heard from Heather is that it varies, right? Those portals vary. She uses 80 to 100,
Absolutely. Unfortunately, there is not one stop shop. And again, a lot of the insurance companies are not doing their own prior authorizations. It's very frustrating as well for the patient, because when we're saying that we're getting a prior authorization, but it's pending clinical documentation, and so there's a delay on it, the first place the patient goes is actually calling the insurance company. But the insurance company, more than likely, is not doing the prior authorization, and they don't even see that a prior authorization is pended, approved, denied until the test is complete and the patient has had it and we submitted the claim. So we've got a lot of times where the patient gets frustrated and they think they're going to call the insurance company, and then they call us back and say, oh, well, you haven't even submitted the prior authorization. They don't have it. Well, because they go to a third party, and they don't, a lot of times they don't communicate with each other. So, and they don't, obviously the insurance companies don't relay that to the patient while they're talking to them. So yeah, and there's not a lot of them that there's not a lot of top three. There's not, it varies, every single one of them.
Heather, most cardiology offices have difficulty with prior auth. Please share your specific examples for success in cardiology. Any tools beyond amplity.com that helped you most with maybe prior auth?
I'll tell you, I mean, if I wasn't organized in what I did, if I wasn't proactive in what I was doing, I wouldn't be able to get my job done. I mean, the probably the biggest example is, and the biggest success that we have is that I have to consistently communicate not only with myself, the physicians, the front desk, the medical assistants, really the timeline it takes for me to, from when it times to get on the schedule to when a test is going to be done, what my process is. Because obviously I've got the physician, I've got the patient who needs this test. A lot of the physicians may not understand that I can't send them in the back and get it done within 5 minutes because they have an insurance company that takes 2 weeks to get an approval. So the bigger I make it known of what I need from them and what they can do for me, really, that's probably the biggest success that we have with our particular office. We have 2 offices that we work for, Cardiovascular Institute, and I do prior authorizations for both offices, as well as the outpatient hospital testing. If we did not have such a great communication base within every single person that we had, we wouldn't be able to get the job done. So it starts with me. It starts with the communication. It starts with teamwork. And because I'm fortunate to work for a company that has really a lot of great teamwork, that's where I find the success.
Thank you, Heather. I also to address the answer that question that came in earlier about buy and bill. Someone mentioned that they're in oncology. I missed it. They're in oncology and they do bill it under the buy and bill under medical. To that original question. When you are working for a third party, you are not able to utilize the portals. Do you have any advice?
My question is, if when you're working for a third party, you're not able to utilize the portals. Is it because you're not registered? Because you have to register in order to work with the portals. So, the majority of the portals that I use, I've registered myself. There are some that, because we're affiliated with hospitals, there are some that the hospitals have registered me as an authorized user. There are some that I become the actual administrator of my office to utilize other people to use those portals. Unfortunately, if you don't have access to the actual portals to submit anything electronically, the only option that you have is to call the third parties to manually call and request prior authorizations. But you should be able to talk to your office or whatever it is to see what your hierarchy is. But in order to use the majority of the portals, you have to become a registered user.
Who is best at handling the prior auth process in an office or system? My administration has our MA RN doing it. I believe we need a dedicated pre-cert team that make it more efficient rather than multi-role tasking. That's a great question.
I do agree that a dedicated person should be doing pre-certifications. It is a lot of work, and for medical assistants or nurses, they have other things going on in the office, other jobs, and it's something very time consuming. So for it to be efficient, somebody experienced, should be dedicated to just doing the prior authorizations.
I agree with that 1,000,000%. I am not clinical whatsoever, but I am the dedicated person to do the prior authorizations. I find a little bit though, there's some sort of a detriment from that, because there are some insurance companies when they want to do a peer-to-peer, because they have additional questions. Because I am not clinical, I am not a PA, I am not a CMA, I am not, even though I have all the information right at my hands, they won't talk to me. So, and my physicians are not in the office 7 days a week. So if I don't have that physician open and they want to do a peer-to-peer, and it's not within a certain time frame, if I have a doctor that's not in the office from Thursday to Tuesday, they could essentially deny authorization because they're not talking to a clinical person, even though I have all the experience and I have all the information that I need to clarify and why a test is needed.
Yeah. And then also, Curtis, you can support this with data. If you're bringing this to your practice in your office, the AMA survey, that American Medical Association survey that I mentioned earlier, they also have data on how many physicians in their in nationwide, they have a dedicated team solely for prior authorization. And I believe that survey, the number was about 35% of physicians surveyed, they had a team dedicated only for prior authorizations, because as again, prior authorization programs are growing, we're seeing that cycle of labor costs, right? We welcome in more patients. We now have more of a need for prior authorizations. Now there's more hours and more paperwork that's needed and required to submit that documentation, which now means I need more staff to support that documentation in the time that's needed. So again, we're just in this continuous cycle. And you're pulling away time from your medical assistants and your nurses that are completing those. And so that may also help you to support your stance there on having that dedicated team. That's a great question. What can office do to be more successful with prior auth approvals? Any tools or services recommended?
I think, again, the open communication with the entire office is the first-hand key. Understanding that the physicians and the office staff have a basic knowledge of how long it takes for me to get an authorization is really the first-hand key. And if an exception needs to be made, what other things that we can do in order to get the answers that the physician needs to assist this patient. If you have absolutely no communication or anything like that, that's where you are completely broken down. So the more open you are with your needs and what the physician's needs are, and looking outside the box to make sure that you can get that done, really is what makes your office successful.
Just providing the staff with, the information needed for office notes. One of the biggest additional information is needed is because office notes are missing a BSA. BSA is a requirement for all our patients on biologics. So just providing the staff what they need to do is just makes it all very efficient and just will guarantee more approvals. A lot of the denials are for because they didn't try and fail medication, but it's not listed in the note. Tried and failed has to be in the note. BSAs have to be in the note. Locations have to be in the note. If they can't swallow pills, it has to be in the note. If they want less injections, it has to be in the note. If it's not in the note, it never happens. So putting as much information in there as possible, quality of life, that kind of stuff. We'll keep it moving. So once you even get a denial, you could go straight to an appeal and all the information is already documented.
Good.
It's
These
all
are
out
great
there.
insights.
You have to kind of get it all in one place, for your staff.
And these are great insights. And again, we had a challenges and solutions and strategies slide here earlier in our presentation, which again will be available here in just a few minutes now that we're going to close out the webinar here. There are still some questions that were left in the chat that were unanswered. If you still have those questions and they still remain, please feel free to reach out to us directly or to our speakers. Thank you all for joining us today and for your thoughtful questions. They were needed. It seems like we got a lot of insights from our attendees as well as the chat. Dina and Heather, I am so grateful for your expertise and insights on this critical issue today. Prior authorizations, they will undoubtedly continue to be a major challenge in healthcare. But learning and understanding solutions to those challenges that we face through webinars and further learning and education is key. Again, please feel free to reach out to ACMA. Our website here is priorauthtraining.org if you have any further questions or would like to connect with our speakers. Thank you all again and have a great rest of your day.
Thanks, everybody. Take care.
Thank you.